When it comes to hair loss, everybody wants to shift to oral minoxidil from topical. I understand why. Topical minoxidil, it's a hassle to apply, you might find it greasy and it might make your hair stiff. Today, as a dermatologist, let me explain you how minoxidil works, what are the advantages, what are the disadvantages, and who can actually consider oral minoxidil. Hi, this is Dr. Ravali Yalamanchili, Chief Dermatologist, Sneha Dermatology and Aesthetics. Not just hair, minoxidil is also an anti-hypertensive medication. When it comes to hair fall, minoxidil increases the blood flow to the hair follicles, thereby it keeps the hair in a growing phase or an anagen phase for a longer duration. This helps in improving the overall quality and it improves your hair growth. So when it comes to baldness, be it male pattern hair loss or female pattern hair loss, which is because of the hormone DHT, minoxidil does not block DHT, it only promotes hair growth. Please understand that DHT blocker is actually Finasteride and this helps in slowing down the process of baldness. So when it comes to topical application of your minoxidil, be it your lotions, solutions or foam-based formulations, it is available as 2%, 5% and even 10%. The advantages of topical minoxidil is that it is FDA approved in terms of male and female pattern hair loss. It is local, there is no systemic absorption and there is limited systemic side effects because of this. But the problem with topical minoxidil is if you are someone who has dry or itchy sensitive scalp and you're also someone who has extensive seborrheic dermatitis or dandruff, minoxidil can further worsen these conditions and you might have redness, irritation and burning sensation the minute you apply the product. The other problem with minoxidil that most of the people complain about is the application. It is a hassle to use it every single day. It is easy for me as a dermatologist to tell you that please use your solution every day, at least 5 to 6 days a week. But when you're using it on a regular basis and your scalp feels sticky and itchy, it is not so easy on a regular basis. So this is the reason oral minoxidil tablets have come into picture and have become more famous these days. Oral minoxidil tablets also work in similar way, but we do not use it in a dose that we use for hypertension. We use a very low dose of medications of 1.25 milligrams or 2.5 milligrams for hair loss. So when it comes to oral minoxidil, yes, it has its advantages about compliance. It is easy to use. There is no problem of stickiness, and someone who has extensive seborrheic dermatitis, their scalp condition doesn't worsen and it doesn't cause any shedding of hair because of increased inflammation. But the problem with oral minoxidil is, at the end of the day, it is an anti-hypertensive medication. So it should be used under caution with people who have heart diseases, hypertension. It can also cause some fluid retention and it can also cause hypertrichosis or increased hair growth in other parts of the body. This is the reason oral minoxidil is not a self-prescription medication. It should be used with caution only under a dermatologist's advice. And you should also understand the pros and cons of both oral and topical minoxidil and see what works the best in your scenario. So who should consider oral minoxidil is someone who is very poor with their compliance, who is not tolerating topical minoxidil, and someone with diffuse thinning, and also someone who is not responding that well to topical minoxidil can consider switching to oral minoxidil and see how it works. In some individuals, we also use a combination of topical and oral minoxidil, wherein we choose a low-dose oral minoxidil and combine it with low-dose topical minoxidil to have advantages of both the medications together. So with both oral and topical minoxidil, the initial changes is that you might see some shedding of hair in the first 1 to 2 months. From 3rd to 6th month, you will notice that there is new hair growth and the ultimate results takes easily around 9 to 12 months. Be it oral or topical minoxidil, compliance is the main thing when it comes to the results. Oral or topical, talk to your dermatologist and see what works best in your situation. Do not choose oral minoxidil just for the convenience. Try to understand what it can do to your body in general. And also, if you're someone who has male pattern hair loss or female pattern hair loss because of genetic issues, you always should combine it with Finasteride tablets or Finasteride solutions. Only then you'll understand that the thinning will slow down along with new hair growth. Please do not self-medicate with any of these medications. They should be given strictly under a dermatologist's supervision. And if you have further doubts and if you want to know what is the right treatment option in your case, please visit a qualified dermatologist. If you want more information about this, please comment below. And if you like this video, share it with your friends and subscribe to my channel.